Have you recently been prescribed Amlodipine / Valsartan 10-160 mg with hydrochlorothiazide 25 mg for high blood pressure? Most people think it's just another blood pressure pill. But the truth is, this powerful combination affects much more than your blood pressure. It works on your blood vessels, your heart, your kidneys, and even the balance of salt and water inside your body. For millions of people, this medicine helps prevent heart attacks, strokes, and kidney damage. But because it's a combination of 3 powerful medicines, it can also cause side effects that many patients never expect. Some people feel perfectly fine after taking it, while others notice dizziness, swollen feet, frequent urination, or even changes in their kidney function within the first few weeks. So how do you know what's normal? And what could be a warning sign? In this video, you'll learn 7 important effects of amlodipine, valsartan, and hydrochlorothiazide, including the symptoms you should never ignore, why some people experience more side effects than others, and how to take this medicine safely. Let's begin by understanding what this medicine really is, and why doctors prescribe it so often. Although many people think this is a single medicine, it's actually a combination of 3 different blood pressure medicines, each working in its own unique way. The first medicine is amlodipine. It belongs to a group of medicines called calcium channel blockers. It works by relaxing and widening your arteries, allowing blood to flow more easily throughout your body. As your blood vessels relax, your heart doesn't have to work as hard to pump blood. The second medicine is valsartan, which belongs to a group called angiotensin receptor blockers, or ARBs. It blocks a natural hormone called angiotensin II. Normally, this hormone causes blood vessels to tighten and raises blood pressure. By blocking its action, valsartan helps keep blood vessels relaxed while also protecting the heart and kidneys from long-term damage. The third medicine is hydrochlorothiazide, often called a water pill or diuretic. It works inside the kidneys, helping your body remove extra salt and water through urine. This reduces the amount of fluid flowing through your blood vessels, making it easier to lower blood pressure. Each medicine attacks high blood pressure from a different direction. When they're combined, they provide much stronger blood pressure control than any one medicine alone. That's exactly why doctors often prescribe this combination for people whose blood pressure remains high despite taking 1 or 2 medications. But because these medicines affect your heart, kidneys, blood vessels, and body fluids all at the same time, they can also produce several important effects, some helpful, others that require attention. Let's go through them one by one. Effect number 1, low blood pressure. The very first effect many people notice after starting this medicine is that their blood pressure drops exactly as intended. However, sometimes it drops a little too much. When blood pressure falls lower than your body is used to, your brain may not receive enough blood for a few seconds. As a result, you might suddenly feel lightheaded, weak, or as if you're about to faint. Some people describe it as a sudden wave of dizziness that appears whenever they stand up too quickly. You may also notice blurred vision, unusual tiredness, or difficulty concentrating. These symptoms are especially common during the first few days after starting the medicine or after your doctor increases the dose. This happens because amlodipine relaxes your blood vessels, valsartan prevents them from tightening again, and hydrochlorothiazide removes extra fluid from your body. Together, these 3 medicines can lower blood pressure very effectively. Older adults are usually more sensitive because their bodies adjust more slowly to sudden changes in blood pressure. People who become dehydrated from hot weather, vomiting, or diarrhea may also experience stronger symptoms. Fortunately, your body often adapts after the first week or 2, and the dizziness gradually improves. To reduce the risk, doctors usually recommend standing up slowly from a sitting or lying position and drinking enough fluids unless you've been told to limit them. However, if you actually faint, experience severe weakness, chest pain, or your blood pressure stays dangerously low, You should contact your doctor immediately because your medication may need adjustment. Effect number 2, dizziness and loss of balance. Another very common effect is dizziness and poor balance. Many patients say they feel perfectly fine while sitting down, but the moment they stand up, the room seems to spin for a few seconds. Others describe the feeling as walking on a moving boat or feeling unsteady on their feet. This happens because your brain temporarily receives slightly less blood while your body is adjusting to the lower blood pressure. Although the dizziness usually lasts only a short time, it can become dangerous if it causes you to lose your balance. For older adults, this increases the risk of falls, broken bones, and head injuries. The chances of dizziness are usually higher during the first few weeks of treatment or after increasing the dose. You may also notice that dehydration, skipping meals, drinking alcohol, or standing up too quickly makes the symptoms worse. Doctors often advise patients to rise slowly, hold on to something stable before walking, and avoid driving or operating heavy machinery until they know how the medicine affects them. If the dizziness becomes severe, continues throughout the day, or causes repeated falls, your doctor may decide to adjust your treatment. Effect number 3, swollen feet and ankles. One side effect that surprises many people is swelling around the feet and ankles. Even though this medicine lowers blood pressure, some patients notice that their shoes suddenly feel tighter by the evening. This swelling is most commonly caused by amlodipine. As the medicine relaxes small blood vessels, tiny amounts of fluid can leak into the surrounding tissues. Over time, this fluid collects around the ankles and feet, causing noticeable puffiness. For some people, the swelling is mild and barely noticeable. For others, it becomes uncomfortable enough to make walking difficult. The swelling is often worse after standing or sitting for long periods and usually improves overnight while lying down. Many patients worry that this means their kidneys are failing or that their heart is getting worse. Fortunately, in most cases, ankle swelling from amlodipine is not dangerous. It's simply a known side effect of how the medicine works. However, it's still important to tell your doctor because sometimes reducing the dose or changing medications can solve the problem. On the other hand, if the swelling is sudden, severe, or accompanied by chest pain, difficulty breathing, or rapid weight gain, seek medical attention immediately, as those symptoms could indicate a more serious medical condition rather than a simple medication side effect. Effect number 4, dehydration and electrolyte imbalance. The fourth effect of this medicine happens because of hydrochlorothiazide, the water pill in this combination. Its job is to help your kidneys remove extra salt and water from your body. This lowers blood pressure by reducing the amount of fluid flowing through your blood vessels. While this is very effective, sometimes the medicine removes more fluid than your body actually needs. When that happens, you can become dehydrated. At first, the symptoms may seem mild. You may feel unusually thirsty, notice a dry mouth, or develop a headache that wasn't there before. Some people become extremely tired, while others feel weak even after getting enough sleep. As dehydration becomes more severe, you may experience dizziness, muscle cramps, confusion, or even a rapid heartbeat. But dehydration isn't the only concern. As your kidneys remove extra water, they can also wash out important minerals called electrolytes, especially potassium and sodium. These minerals help your muscles, nerves, and heart function normally. If their levels become too low, your body may begin sending warning signs. You might notice painful muscle cramps, twitching, unusual weakness, constipation, or an irregular heartbeat. Some people even feel mentally foggy or have trouble concentrating. These problems are more likely during hot weather, after heavy exercise, or if you've had vomiting or diarrhea while taking this medicine. That's why doctors often recommend periodic blood tests after starting hydrochlorothiazide. These simple tests allow them to detect electrolyte changes long before they become serious. Drinking enough fluids, unless your doctor has restricted your intake, can also help reduce the risk. If you ever experience severe dehydration, persistent vomiting, confusion, or a racing heartbeat, don't ignore these symptoms. Contact your healthcare provider as soon as possible because your medication or fluid balance may need adjustment. Effect number 5, kidney function, changes. Another important effect involves your kidneys. Many people are surprised to learn that this medicine can both protect the kidneys and temporarily affect kidney function, depending on the situation. Valsartan is well known for protecting the kidneys over the long term, especially in people with diabetes or high blood pressure. Lower blood pressure also helps reduce damage to the tiny blood vessels inside the kidneys. However, when treatment first begins, blood flow inside the kidneys changes. For most healthy people, this isn't a problem because the kidneys quickly adjust. But in certain individuals, kidney function may temporarily decline. This is more likely in older adults, people who already have kidney disease, severe dehydration, heart failure, or those taking painkillers like ibuprofen, naproxen, or diclofenac on a regular basis. These medicines can reduce blood flow to the kidneys and increase the risk of kidney injury when combined with blood pressure medications. Most people won't feel anything at all, which is why routine blood tests are so important. However, if kidney function becomes significantly worse, you may notice symptoms such as producing much less urine than usual, swelling that suddenly becomes worse, extreme tiredness, nausea, or unexplained shortness of breath. Doctors usually check kidney function before starting treatment and again several weeks later. If the results remain stable, there's usually nothing to worry about. The good news is that for most patients, these medicines actually help protect the kidneys over time by keeping blood pressure under good control. The key is regular monitoring and staying well hydrated unless your doctor advises otherwise. Effect number 6, frequent urination. One of the earliest effects many patients notice is needing to use the bathroom much more often. This happens because hydrochlorothiazide is a diuretic, commonly known as a water pill. Its job is to help your kidneys remove extra salt and water from your bloodstream. As a result, your body produces more urine, especially during the first 4 to 6 hours after taking your daily dose. For many people, this effect is completely normal and actually shows that the medicine is working. However, frequent urination can sometimes become inconvenient. You may find yourself searching for a restroom more often than usual or waking up during the night if you take the medicine too late in the day. That's exactly why doctors usually recommend taking hydrochlorothiazide in the morning. This allows most of the extra urination to happen during the daytime instead of interrupting your sleep. Although increased urination is expected, losing too much fluid can sometimes lead to dehydration. If you begin feeling extremely thirsty, weak, dizzy, or notice that your urine becomes very dark, these may be signs that your body is losing more water than it should. In most cases, drinking adequate fluids and following your doctor's instructions is enough to keep everything balanced. But if frequent urination becomes excessive or is accompanied by severe weakness or fainting, you should let your doctor know. Effect number 7, changes in potassium levels. The 7th effect is one of the most important because it involves potassium, a mineral your heart depends on every second of the day. Hydrochlorothiazide tends to lower potassium levels by removing it through the urine. On the other hand, Valsartan may increase potassium by reducing the amount your kidneys remove. Because these two medicines affect potassium in opposite ways, the final result can vary from person to person. Some patients develop low potassium, while others develop high potassium, depending on their kidney function, diet, and any other medications they're taking. If potassium drops too low, you may notice muscle weakness, painful leg cramps, unusual fatigue, constipation, or an irregular heartbeat. Some people feel their heart skipping beats or beating faster than normal. If potassium becomes too high, the symptoms can be very different. You may experience muscle weakness, numbness, tingling sensations, or a slow, irregular heartbeat. In severe cases, high potassium can interfere with the heart's electrical system and become life-threatening. The problem is that many people don't notice any symptoms until potassium levels become significantly abnormal. That's why doctors often request regular blood tests after starting this medicine or increasing the dose. These tests help identify changes early, long before serious complications develop. You should never start potassium supplements or salt substitutes containing potassium unless your doctor specifically tells you to. While they may seem harmless, they can sometimes raise potassium to dangerous levels when combined with valsartan. Fortunately, with regular monitoring and proper medical follow-up, potassium problems are usually easy to prevent and treat. Many patients wonder whether amlodipine 10 mg, valsartan 160 mg, and hydrochlorothiazide 25 mg is considered a strong combination. The answer is yes. Amlodipine 10 mg is the maximum commonly prescribed daily dose. At this strength, it provides powerful blood vessel relaxation, but also increases the likelihood of side effects such as ankle swelling and dizziness. Valsartan 160 mg is also a high therapeutic dose that offers excellent blood pressure control and long-term protection for the heart and kidneys. Hydrochlorothiazide 25 mg is stronger than the more commonly prescribed 5 mg dose. While it lowers blood pressure more effectively, it can also increase urination, dehydration, and electrolyte changes in some patients. When all three medicines are combined, they work together to control blood pressure far better than any one medicine alone. However, because each medicine has its own effects, some patients notice stronger side effects during the first few weeks of treatment. For this reason, doctors usually start with lower doses whenever possible and gradually increase them until blood pressure reaches a healthy target. This slow approach allows your body time to adjust while reducing the chance of troublesome side effects.